Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into the world of a virus that is both common and commonly misunderstood in our canine companions, canine herpes virus 1. You may have heard it mentioned in passing, perhaps linked to fading puppy syndrome or kennel cough, but its impact on dog health, particularly in breeding populations, is far more complex and significant than many realize. This virus, a member of the alpha herpes virus family, has a global presence, and understanding its behavior is crucial for veterinarians, breeders, and dog owners alike. First identified back in 1965 as the culprit behind a devastating and fatal hemorrhagic disease in newborn puppies, canine herpes virus, or CHV. One, as it is scientifically known, has since been found in dog populations all over the world. Serological studies paint a picture of a widespread pathogen, with prevalence rates varying dramatically from one region to another. For example, studies have reported seroprevalence as high as 88% in England and 80% in Norway, while other areas show lower figures, like 46% in Belgium, 39% in Netherlands, and even as low as 6% in Washington state in the United States. These numbers tell us that a significant portion of the global dog population has been exposed to this virus. So what exactly is this virus, and what does it do? Let's unravel the story of canine herpes virus. Canine herpes virus is a classic alpha herpes virus, and like its relatives that infect humans and other animals, it has a defining characteristic: the ability to establish a lifelong, latent infection. After an initial infection, which can be symptomatic or completely silent, the virus retreats into the dog's sensory ganglia, nerve cell clusters like the trigeminal ganglia in the head or the lumbosacral ganglia near the pelvis, where it lies dormant. It can remain hidden for months or even years, only to reactivate during periods of stress, pregnancy, or immunosuppression, leading to shedding of the virus and potential transmission to other susceptible dogs. This cycle of latency and reactivation is the key to its persistence in kennels and breeding populations. The virus itself is relatively fragile outside the host. It's an enveloped virus, which means it is sensitive to common disinfectants and doesn't survive long in the environment. Transmission, therefore, requires direct contact. The primary routes are through licking, coughing, and contact with infectious oronasal or genital secretions. Venereal transmission during mating is a significant route, as is transplacental spread from an infected dam to her fetuses in the womb. For newborn puppies, the journey through the birth canal can be a moment of first exposure, as can contact with the dam's saliva or nasal discharge after birth. This intimate mode of transmission explains why the virus thrives in environments where dogs are in close contact, such as breeding kennels. Now, let's explore the diverse and age-dependent diseases caused by this virus, because the outcome of a canine herpes virus infection depends critically on the age and immune status of the dog. The tragedy of neonatal mortality. The most devastating manifestation of canine herpes virus is the acute, systemic, and often fatal disease it causes in neonatal puppies. This is the classic fading puppy scenario that strikes terror into the hearts of breeders. The virus is most dangerous to puppies from birth up to about 3 weeks of age, especially if they are born to a mother who has never been exposed to the virus herself and therefore has no antibodies to pass on to them. These immunologically naive puppies are highly susceptible. After infection, the virus replicates in the nasal passages, pharynx, and tonsils before spreading throughout the body via the bloodstream, a state known as cell-associated viremia. A critical factor that exacerbates the disease in these very young puppies is their inability to regulate their body temperature effectively. The virus replicates optimally at temperatures slightly lower than a healthy adult dog's body temperature, and the relative hypothermia of a newborn puppy provides the perfect environment for the virus to run rampant. The clinical signs in these puppies are heartbreaking. They often cry persistently, lose interest in nursing, become lethargic and depressed, and may have soft, yellowish-green stool and abdominal pain. A serous or even bloody nasal discharge can be seen, along with tiny hemorrhages called petechiae on their mucous membranes. The illness progresses rapidly, typically over just 1 to 3 days, and tragically, mortality rates in an affected litter can approach 100%. If a necropsy is performed on a puppy that has succumbed to the virus, the findings are stark and characteristic. The pathologist will often find multifocal areas of necrosis and hemorrhage scattered throughout numerous organs. The kidneys are a classic sight, often appearing swollen and pale with a spotted or speckled appearance due to the numerous small hemorrhages across their surface. The liver, Lungs, spleen, adrenal glands, and even the brain can show similar damage. Histologically, under the microscope, these tissues reveal cell death, bleeding, and sometimes the telltale sign of a herpes virus infection, eosinophilic intranuclear inclusion bodies within the cells, which are essentially viral factories. The brain is also commonly affected, leading to what is known as meningoencephalitis. The neuropathology in these natural cases often includes multifocal glial nodules, which are small clusters of immune cells, meningeal inflammation, and notably necrosis of the cerebellar cortex. Reproductive havoc beyond the newborns. While neonatal death is its most dramatic effect, canine herpes virus is also a significant cause of reproductive problems in adult dogs. The virus can lead to a frustrating array of issues for breeders, including infertility, embryonic resorption, where early pregnancies simply vanish, mummification of fetuses, abortions, and stillbirths. When a pregnant dam who is immunologically naive becomes infected for the first time, particularly in the later stages of pregnancy, the consequences can be severe. The virus can cross the placenta and infect the developing fetuses, leading to their death in the womb. Even if the puppies are born alive, they're often weak and succumb to the neonatal form of the disease shortly after birth. The dam herself may show few or no clinical signs, making the diagnosis even more challenging. The virus can also cause visible lesions on the genitals of adult dogs. In both males and females, a primary genital infection can manifest as papulovesicular lesions, small, blister-like bumps, on the vaginal mucosa or on the prepuce and base of the penis. These lesions are a direct source of virus for venereal transmission during mating. The immune status of the dam is the single most important factor determining the outcome for her litter. If a dam is seropositive, meaning she has antibodies from a previous infection, she can pass this protective immunity to her puppies through her colostrum, the first milk. These maternal antibodies protect the puppies during their most vulnerable first few weeks of life. Even if these puppies get infected, the maternal antibodies usually prevent the severe systemic disease, and the infection remains localized to the upper respiratory tract. This is why a dam who loses a litter to herpes virus will often have perfectly healthy litters in subsequent pregnancies. Her own immune system has now been primed to protect her future offspring. However, this also means that seronegative bitches in an environment where the virus is circulating are at extremely high risk. A player in the respiratory disease complex. In older puppies and adult dogs, canine herpes virus infection usually takes on a much milder form, primarily affecting the upper respiratory tract. It's considered one of the many viral and bacterial agents involved in the canine infectious respiratory disease complex, more commonly known as kennel cough. Experimental infections have shown that the virus can cause mild rhinitis and pharyngitis, and in some cases, tracheobronchitis. However, in most naturally infected adult dogs, the signs are often so mild they go unnoticed, or the infection is completely asymptomatic. The situation can become more serious in dogs that are stressed or immunosuppressed, such as those in crowded shelter environments or those receiving immunosuppressive therapies for other conditions. In these cases, the respiratory signs can be more severe, and the virus can contribute to more significant disease, including pneumonia, especially when co-infections with other pathogens like Bordetella bronchoseptica are present. The respiratory tract is a crucial site for the virus. It's a major portal of entry, a site of replication during both primary infection and reactivation, and a source of aerosolized virus that can be shed to infect other dogs. The eyes have it. Ocular disease. Canine herpes virus also has a distinct predilection for ocular tissues, causing a range of eye problems that vary with the dog's age and the type of infection, primary or recurrent. In puppies suffering from severe neonatal systemic disease, the virus often disseminates to the eyes, causing devastating intraocular damage. This can include panuveitis, inflammation of all parts of the uvea, retinitis, and optic neuritis. The inflammation, hemorrhage, and necrosis can lead to permanent damage, including retinal dysplasia, cataracts, and blindness in any puppies that manage to survive the systemic illness. In mature dogs, ocular herpes is typically less severe and restricted to the surface of the eye. It can manifest during a primary infection or, more commonly, during a recurrent episode when latent virus reactivates. The clinical signs can be nonspecific, like squinting, light sensitivity, and discharge, but the pain is often disproportionately severe for the visible lesions. The most common lesion is conjunctivitis, which can sometimes be accompanied by conjunctival petechiae, tiny pinpoint hemorrhages. a finding that should raise a clinician's suspicion for herpes virus. The most classic and diagnostically significant ocular lesion, however, is ulcerative keratitis, specifically dendritic corneal ulcers. The term dendritic refers to their characteristic linear, branching, tree-like pattern on the corneal surface. These superficial ulcers are strongly suggestive of an active alpha herpes virus infection. A key feature to look for are prominent terminal end bulbs, club-shaped swellings at the tips of the ulcer's branches, which help differentiate them from other causes of linear scratches on the cornea. These dendritic ulcers can sometimes merge to form larger, irregularly shaped geographic ulcers. While often mild and self-limiting in healthy adult dogs, recurrent ocular disease can be frustrating for owners and uncomfortable for the dogs. In immunocompromised dogs, the ocular lesions can be much more severe, persistent, and difficult to treat. Unraveling the virus's secrets: pathogenesis, neurology, and genetics. So, how does this virus cause such different diseases? A key part of the answer lies in its interaction with the host's nervous system and its genetic makeup. As we've touched on, after the initial infection at a mucosal surface like the nose or genital tract, the virus travels up the sensory nerves to the neuronal cell bodies in the ganglia, where it establishes latency. It can remain there, undetected by the immune system, for the life of the dog. Reactivation allows the virus to travel back down the nerve axons to the mucosal surface, where it replicates and is shed, ready to infect a new host. This shedding is often asymptomatic, meaning a latently infected dog can be a silent source of infection for others. This is particularly important in breeding kennels, where an apparently healthy dog could reactivate and shed the virus, posing a threat to pregnant females and young puppies. Recent studies looking at the brains of puppies that died from naturally acquired infections have shed more light on the virus's neuropathology. The most consistent findings are glial nodules, which are focal accumulations of microglial cells, mild meningeal inflammation, and necrosis in the cerebellum. Using a technique called in situ hybridization, which can detect viral genetic material directly within tissue sections, researchers have shown that the virus has a strong tropism for specific cells. It consistently targets the developing granule neurons of the cerebellum, especially the internal granular layer and the endothelial cells that line blood vessels in both the brain and meninges. This endothelial tropism might be how the virus gains entry into the brain from the bloodstream. The fact that it targets rapidly developing neurons in the cerebellum helps explain the severe neurological consequences and damage seen in young puppies. On the genetic level, canine herpes virus is quite interesting. Its genome is about 125 kilobase pairs in size and has a structure typical of its varicella-virus genus. One of its most remarkable features is its nucleotide composition. It has an exceptionally low G plus C content, around 31 to 32%, which is the lowest among all fully sequenced alpha herpes viruses. Despite being found all over the world, canine herpes virus shows very little genetic diversity. Strains isolated in the United Kingdom over a 15-year period were almost identical to each other, and they're also highly similar to strains from the United States, Australia, and Japan. This has led to the virus being described as monotypic, meaning there's essentially just one major antigenic type worldwide. However, more recent, high-resolution whole genome sequencing has revealed some subtle but important evolutionary patterns. Phylogenetic analysis shows its closest relative is feline herpes virus 1, the cause of cat flu. And just recently, phylogenomic studies have identified a completely separate second clade, or genetic group, of the virus, represented by strains from Brazil, the United States, and now Italy. This suggests there might be more genetic structure to this virus than previously thought, which could have implications for its evolution and epidemiology. The diagnostic dilemma: finding a ghost. Diagnosing canine herpes virus infection can be tricky, largely because of its stealthy nature. Several methods are available, each with its own strengths and limitations. For a deceased puppy, a definitive diagnosis is often made at necropsy based on the characteristic gross and histopathological lesions, especially the hemorrhagic and necrotic spots on the kidneys and other organs. Virus isolation from these tissues can confirm the diagnosis. The virus grows well in canine kidney cell cultures, where it produces a typical cytopathic effect of rounded, grape-like clusters of cells. In living animals, the diagnostic approach is more complex. Serology, using tests like the serum neutralization test or an enzyme-linked immunosorbent assay, can detect antibodies to the virus, indicating past exposure. However, interpreting serology can be a minefield. The virus is considered poorly immunogenic, and antibody titers can decline within a few months of infection. Some dogs that are latently infected can even become seronegative over time. Furthermore, titers can fluctuate due to reactivation or re-exposure. This means a single negative result doesn't rule out infection, and a single positive result only confirms exposure at some point in the past, not necessarily an active problem. Repeated testing of multiple dogs in a kennel setting is often needed to get a true picture of the virus's activity. The most sensitive and specific diagnostic tool currently available is the polymerase chain reaction, or PCR test. Real-time PCR assays can detect and even quantify viral DNA in clinical samples like ocular, nasal, or vaginal swabs, or in tissues. This is the most reliable way to detect active viral shedding. However, even PCR has its challenges. Because viral shedding after reactivation can be brief, sometimes lasting only a few days, and intermittent, a single swab at the wrong time can easily miss it, leading to a false negative result. To increase the chances of detection, especially for screening purposes before mating, it may be advisable to collect samples on several consecutive days. Management, prevention, and the vaccination question. Given the often devastating consequences of canine herpes virus, especially in breeding kennels, what can be done to control it? For neonatal puppies already showing clinical signs, the prognosis is very poor, and treatment is largely supportive. This can include providing supplemental warmth to raise their body temperature, as the virus replicates less efficiently at higher temperatures, along with fluid therapy and nutritional support. Antiviral medications, such as vidarabine or acyclovir, have been used in some cases, but their safety and efficacy in neonatal puppies are not well established. And even if they survive, puppies may be left with permanent neurological or ocular damage. For mature dogs with ocular herpes, topical ophthalmic antiviral drugs like idoxuridine or trifluridine can be effective in managing active ulcerative keratitis. Prevention is, therefore, the cornerstone of managing this virus. This revolves around understanding and mitigating the risk factors. Several factors have been strongly associated with a higher risk of canine herpes virus-related reproductive disease. These include being housed in a large breeding kennel, having a history of kennel cough in the facility, poor hygiene, and the use of non-resident males for mating. Good biosecurity and hygiene are essential. Because the virus doesn't survive well in the environment, regular cleaning and disinfection can significantly reduce transmission. The most critical period to protect against infection is what has been termed the 6-week danger period. This encompasses the last 3 weeks of a dam's pregnancy and the first 3 weeks of her puppy's lives. Isolating the pregnant dam during this time can help protect her and her impending litter from exposure to shedding dogs. Since maternal antibodies are so crucial for puppy survival, one strategy has been to ensure that bitches are exposed to the virus and seroconvert well before they are bred. In kennels where the virus is endemic, many bitches will be naturally immunized through contact with other dogs and will have protective antibody titers by the time they are of reproductive age. But what about vaccination? An inactivated subunit vaccine is commercially available in Europe and other regions. It is specifically indicated for administration to pregnant bitches. The protocol typically involves 2 doses, one during heat or early pregnancy, and a second dose 1 to 2 weeks before the expected whelping date. The goal of this vaccine is not to prevent infection in the dam, but to stimulate a high level of neutralizing antibodies that she can then pass on to her puppies, protecting them from the fatal neonatal disease. It has been shown to be effective in protecting pups. However, this vaccine is not available worldwide, is not always routinely used even where it is available, and does not prevent the dam from becoming latently infected or from potentially reactivating the virus later in life. In conclusion, canine herpes virus 1 is a complex and formidable pathogen. It is a silent resident in a large portion of the world's dog population, capable of causing a spectrum of diseases from mild respiratory sniffles to heartbreaking reproductive failure and neonatal death. Its ability to hide in a latent state and reemerge under stress makes it a persistent challenge, especially in multi-dog environments. While our diagnostic tools have become more sophisticated, allowing us to detect the virus with greater sensitivity, its brief and intermittent shedding patterns mean it can still elude us. Management relies on a deep understanding of its epidemiology, a commitment to sound biosecurity practices, and strategic use of vaccination where available to protect the most vulnerable among our canine companions, the newborn puppies. For this quiet but consequential virus, awareness and vigilance are our most powerful tools. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.